Have you been diagnosed with acute stress disorder? Or do you want to know the difference between PTSD, post-traumatic stress disorder, and acute stress disorder? Well, this will be a quick topic. I have a previous video on all of the criteria of PTSD, also specifically around children. And acute stress disorder is that 30-day period after an acute stress. If we look at kind of trauma and grief theories, there is a period of kind of shock or change that happens post-trauma. You know, almost like your brain goes, wow, or what is going on? And so acute stress disorder is a period of time after trauma where you are experiencing symptoms. So there is an exposure. There is at least a cluster of 9 random symptoms, whereas if you watch the PTSD diagnosis, you will see that it's very specific. So I'm Cristi Bundukamara. I'm a psychiatric nurse practitioner with over 20 years of experience. I have 7 children, and I have a lot of life experience that really adds to my professional experience. And we are going through a series called Demystifying the DSM. The DSM is a book of different diagnoses that we use in psychology and psychiatry. And these are a cluster of symptoms that do have to do with different brain regions and what we know happens. And I'm in this kind of trauma series. So I did PTSD, I did PTSD in children, and this is about acute stress disorder. And so how is that different? Well, I believe that everyone experiences symptoms after trauma. And acute stress disorder is kind of specifically, if you look at the pure criteria in the DSM, it's the first 30 days after. But I can tell you that I often will continue a diagnosis of acute stress disorder because we're still dealing with a trauma, but they don't meet criteria for PTSD. We don't want to overdiagnose, and we also don't want to underdiagnose, and we don't want to say because it's been more than 30 days, you now have major depressive disorder, when it's really still related to that exposure or that trauma. So bad Dr. B, but I will use acute stress disorder longer than 30 days. But if you are a stickler for DSM criteria, it does say that, you know, from the trauma to 30 days of these acute stress symptoms. They're very similar to PTSD, but in acute stress, you can kind of just have a random symptoms. You could have maybe severe symptoms versus light symptoms. And I think that if there wasn't this 30-day criteria thing with acute stress disorder, I would say that I am still experiencing acute stress from the trauma of the morning that I found my daughter dead. And if you don't know my story, find it, follow it. Like I'm turning my pain into purpose, and I'm showing people that you can be okay even when horrible things happen to you, even if you're struggling with depression or different things. But remember that all DSM criteria, there is an impairment in function. So criteria for acute stress disorder is there has to be that exposure to a life-threatening event, witnessed it, or you have like repeated exposure to, you know, kind of hearing about other people's trauma. We see this with 911 operators. We see this with police officers, EMTs. So you have that exposure, and then you have a cluster of 9 symptoms, not as specific as with PTSD. With PTSD, you have to have so many in each category. In acute stress, you just need to have a cluster of like 9 symptoms, right? So it's still impeding your function. And, you know, the big thing here, if you're a stickler, is that acute stress disorder is that 30 days post-stress. But what do you do when you have a client who is meeting criteria for post-stress? It's over 30 days. And we don't really want to give that, you know, PTSD diagnosis at this point. And sometimes, you know, I do like to hold off on these things because clients tend to kind of own them as a chronic long-term condition. And if you know me, you know that I challenge everybody out of that. Your diagnosis is what you struggle with. It's not who you are. These things are treatable. We want to get you better and functioning. And I do not want you to own that diagnosis. I talk about in the PTSD video, in the military, we have something called post-traumatic growth, where we are trying to learn to grow from our trauma. That's not in the DSM. Military terminology uses just post-traumatic stress without the D, without the disorder, right? You know, and so I would say that post-traumatic stress, even though not in the DSM, it's kind of this acute stress disorder prolonged so that we can acknowledge that this trauma is still causing pretty significant stress, but you know, it is treatable. We are getting better. And so these are kind of some changes or terminology that we've used just culturally in the military. And I do use it and I educate a lot of my clients. But the DSM does not have anything that kind of differentiates. We'll talk about in the next video, adjustment disorder. But I don't think that really gives the weight to the trauma or the exposure. And so I like these terms, post-traumatic stress, post-traumatic growth, and even using acute stress disorder over that 30 days. But I'm not one of those sticklers for the DSM, and this is a series on demystifying the DSM. So I'm being very clear that acute stress disorder is exposure. Criteria A is exposure. Criteria B is a cluster of at least 9 of symptoms that exhibit as stress. So intrusive thoughts, memories, dreams, flashbacks, cognitive problems, negative talk, negative or loss of interest in things, changes in memory, changes in arousal, irritability, hypervigilance. Any 9 cluster of those symptoms would be the DSM for acute stress disorder. So this is my series on demystifying the DSM. This is acute stress disorder. We can grow from the stress and the trauma that we have experienced in our life. So come with me on this mentally strong journey because I believe that you are mentally strong. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.